everyone. My name is Dr. Lisa Becht. I'm a double board certified reproductive endocrinology and infertility doctor here at HRC Orange County. I am in the Newport Beach and Mission Viejo offices, and I'm so excited to be chatting with you today. So I have a big passion as well as background in oncofertility. So in my position prior to being here at HRC Fertility, I was actually the director of oncofertility at Columbia University Fertility Center in New York City. As the director, I forged a very good connection with Memorial Sloan Kettering Cancer Center. And that connection was a great pathway for those patients that were getting diagnosed with any type of cancer to be able to come over to our fertility center, be seen, very quickly and get right into treatment if that was something they desired. And so in making that program, I found lots of different kind of tools and key ways to help oncofertility patients. And so now here in Orange County, I've been here a few years. I'd love to be able to expand that here to the offerings to the community. Currently here at HRC, we definitely offer oncofertility. We're able to see patients quickly and get them into fertility preservation cases. So my advice is, I know it can be very overwhelming. There's so many different appointments, people you're supposed to see, places you're supposed to go. So if you're interested in fertility, definitely coming to a fertility doctor like myself is something that fitting that in would be great. Even if it's just a chat and kind of knowing options, even if you decided not to proceed with any type of a fertility preservation, a lot of patients feel being able to talk to a fertility doctor at least gave them information. That being said, if you are interested in trying to freeze eggs or embryos as a female or freeze sperm as a male, we will, make sure to see you right away, get you into a treatment right away. Those are all things that I think can really help with kind of the anxiety and stress of the whole process. So in terms of options as a male, typically we would have you freeze sperm, especially if you might be doing anything that impacts sperm like chemotherapy, radiation to that area. That is quick. You basically would do a consult, and then within a few days, we'd be able to freeze your sperm. As a female, you could freeze eggs, or if you have a partner, you could freeze embryos. That process is longer. It's about 2 weeks because it takes about 10 or so days of injections. During that time, you'll be coming for ultrasounds and blood work. And at the culmination of that, I will literally take your eggs out and either freeze them or combine with sperm to make embryos. So really, those are the 3 types of treatment options, depending on exactly who you are and what you're doing. In terms of other kind of things, definitely sometimes patients just want to come and chat. Maybe they've already had babies and they just kind of want to know what this will impact in terms of future. Sometimes patients just come for information and they might not move forward with the treatment. So absolutely, we understand for cancer, we're trying to do this as quickly as possible. Definitely as a female, if we're trying to freeze eggs or embryos, we will try to get right into the process within a few days of seeing you. You might hear about kind of typical planned out egg freezing or IVF. We start with a period, but for oncofertility, we do what's called a random start. So as soon as you're ready, we would get right into a cycle if that's what's appropriate for your diagnosis. Other times, you might be going right into a surgery, and then sometimes after the surgery, for example, for breast cancer, that point we would actually do your egg or embryo freeze cycle prior to getting into chemotherapy or any type of medical treatment. There will be some patients with diagnoses that maybe preclude us from being able to get right into a cycle. If someone is unfortunately very sick, they're admitted to the hospital, they're starting chemotherapy right away. We won't be able to do that 2-week egg freeze cycle potentially, but at least we'd be able to chat and talk about potential options in the future, hopefully when you're in remission. And so definitely, at whatever kind of type of diagnosis and severity, we can at least chat and see what we can offer. So definitely know the financials of anything fertility is always a concern. So the great news is here in California, there's a law called SB 600 that actually will make insurances cover cycles typically for most types of insurance. So that is something, that first consult, we have a financial coordinator who will do everything in her possible ability to try to get some coverage. Outside of that, if someone had no insurance, there's other programs and grants that often can help cover doing this type of treatment. And then additionally, a lot of the pharmaceutical companies have amazing programs to give typically free medications to do eggs and embryo freezing. And then outside of that, something like Livestrong is a great program that also will coordinate for discounts, other types of medications. So definitely, we would never want financials to be a reason someone doesn't seek care. So we will do everything we can to hopefully make this feasible. So I always love the success stories. So, typically it can take many years sometimes for someone to be able to come back and potentially use their eggs or use their embryos. But I have multiple patients, definitely from my time at Columbia University, just because I've been here 5 years, that have come through. We've stayed in touch. One specifically, she's great. She went through, we would always joke, she froze so many embryos that it was like her own football and cheerleading team all in one. At this point, she's had her 2 babies. She's doing great. She had breast cancer. She's in remission. And then here at HRC, we've had some patients, I've been here 5 years, that have also kind of come through. One specifically just recently came back to transfer an embryo. So oncofertility is a little bit more of a long game just because depending on different types of treatment, sometimes patients might need a few years, up to 5 years, sometimes being on suppressive medications before they might be cleared to come off of that and go through hormone treatment to be able to be pregnant. But it's so rewarding when that's the case. And even the patients that maybe froze eggs and for whatever reason decided they don't want to use them or they still haven't used them, a lot of them have reached out and said, by doing this, knowing that those eggs are frozen, they feel a little bit of relief. And so it's just such a rewarding field. So I'm Dr. Lisa Bacht here at HRC Fertility in Orange County at the Newport Beach and Mission Viejo offices.